See this? What's happening here is an external cephalic version, or ECV. It's a fancy procedure where a doctor presses their hands on the outside of your belly and tries to turn your baby. And why is the doctor trying to turn your baby? Well, your baby's facing the wrong way. Yeah, this is known as the breech position, which is when a baby has their buttocks down and their head up. That's the complete opposite of the ideal position for childbirth, where the baby is in a vertex position, with their head toward the birth canal. A baby's head is the biggest and least flexible part of their body. That's why it's better to get this part through the birth canal first. If your doctor finds your baby is in the breech position during a checkup, the wisest thing to do is simply wait. Yes, you heard that right. Often the fetus will lower its head in the weeks leading up to your delivery date. If it doesn't, well, that's when the ECV comes in. But this procedure isn't suitable for everyone. If you're expecting multiple babies, your water has already broken, or your baby has an abnormal heartbeat, an ECV is off the table. You may have to deliver the baby in the breech position. While they're definitely possible, vaginal deliveries of breech babies are still risky. Chances are your doctor will recommend a C-section instead. It sounds like a lot, I know. But that's just one of the many challenges you might face as a soon-to-be parent. Today, we'll tell you about the 7 most dangerous childbirth complications which could cause birth injuries or even death. So, where do we even start? Labor is typically about 12 to 18 hours for a first-time parent. If it lasts longer than 18 hours, it's considered prolonged labor. Prolonged labor might occur if your baby is of larger than average size or if your uterine muscles are not contracting properly. When this happens, both the birthing parent and baby are susceptible to infections, which, medically speaking, is not good. The doctor will likely give you IV fluids to prevent dehydration and will administer medications to trigger contractions. If the baby still won't come out, doctors may choose to perform a C-section instead. The good news is subsequent births can be easier and take less time. But don't count on it. It's not guaranteed. Cephalopelvic disproportion, or CPD, happens when a baby's head or body won't fit through the parent's pelvis. Typically during birth, the pelvic joint spreads to create room for the baby to pass through the birth canal. If a baby weighs more than 4 kilograms, it may have a hard time passing through a small or abnormally shaped pelvis. Now, there's nothing inherently unhealthy about big babies. We love big babies, but they have a bigger chance of getting stuck in the birth canal and becoming deprived of oxygen, which can cause asphyxia or brain injury. One of the more common occurrences is something called shoulder dystocia. It's when the baby's shoulder gets stuck in the pelvis during delivery. But don't freak out yet. Doctors can diagnose this before the birth even begins. To avoid any of the risks we just covered, you'll likely have to give birth through, here it is again, a C-section, in order to ensure that both you and baby are safe. Oh, and doctors will keep an eye on you after the birth to make sure you don't have any excess bleeding. They've got you covered. Sometimes, either before or during labor, the umbilical cord may slip through the cervix and pass through the birth canal before the baby. This is called umbilical cord prolapse, and it can be extremely dangerous. If the umbilical cord gets blocked, it restricts the amount of oxygen delivered to the fetus. This can result in asphyxia or a disability. If a prolapse occurs, you'll be able to feel the umbilical cord in the birth canal. It might even protrude from your vagina. If you can feel it or see it, it's time to go to the hospital, like right now. While you wait for the paramedics, get on your hands and knees and position your chest on the floor with your buttocks raised. This is the best position to keep your baby from pressing against the cord and cutting off blood or oxygen supply. Once you're at the hospital, you'll likely have to give birth immediately. But what happens when you can't make it to the hospital? Could you deliver your baby on an airplane? What about a NASCAR track? Well, some people have. Seriously, click that subscribe button to discover their stories. The movement of the fetus can sometimes cause the umbilical cord to wrap around it. Most of the time, the situation works itself out and the cord gets unwrapped. However, in some cases, the baby stays tangled, leading to umbilical cord compression. Just like cord prolapse, this too can decrease the amount of blood and oxygen flowing to the infant. Doctors will catch this by monitoring your baby's heart rate and blood pH. They'll pump you with oxygen to increase how much is available for your baby. If necessary, they'll even accelerate the birth by using forceps or vacuum assistance to deliver the child. Smell that? Yeah, that's newborn poop. A newborn's first poop, to be exact. It's called meconium, and you'll know it when you see it. It's usually dark green in color and is typically sticky and thick. Usually, a baby will pass their meconium a few hours or days after being born. But in some rare instances, it can happen too early, during the late stages of pregnancy. You know, when the baby is still in the womb. Meconium aspiration syndrome, or MAS, occurs when a baby inhales meconium during birth. It gets into their lungs, causing trouble breathing, irritating their airways, and even injuring the lung tissue. Meconium can also block surfactant, a substance that helps open up a baby's lungs when they're born. Doctors can identify signs of MAS by checking for green stains in the amniotic fluid or on the newborn. If your baby has difficulty breathing, a slow heart rate, or appears limp, the doctor will order an X-ray to confirm MAS and rule out heart problems or pneumonia. They'll take your newborn into the neonatal ICU to give it oxygen and, if necessary, use a ventilator to help them breathe. In severe cases, they'll try to open the baby's lungs with a surfactant or nitric oxide gas. If your baby has severe complications from MAS, the ICU workers will perform extracorporeal membrane oxygenation using an artificial lung machine. Now, you probably want to know, is there anything you can do to avoid these risks? Well, inducing labor if you are past your due date is a good start. You can also stack the deck in the baby's favor by avoiding harmful substances like tobacco smoke during your pregnancy. Chorioamnionitis is a bacterial infection that can affect a pregnant person's amniotic fluid and fetal membranes, in this case, yours. It's caused by bacterial species that are part of the E. coli and group B strep. Once it enters your amniotic fluid and fetal membrane, it affects your baby's oxygen and nutrient supply. This can cause adverse effects on their brain development and can even cause cerebral palsy. The baby might develop sepsis, meningitis, or pneumonia. And the infection is coming for you, too. Symptoms include a pained uterus or vaginal discharge with an unpleasant smell or unusual color. If you have any of these symptoms, get to a hospital ASAP and get some antibiotics. If you don't get treatment right away, you run the risk of the infection spreading into the pelvic region and abdomen. Here, it could cause blood clots or sepsis. To avoid this scenario, make sure you're tested for group B strep or E. coli infections during the 3rd trimester of your pregnancy. Even though most of these complications are rare, it's good to identify the warning signs so that you know what to do. Also important, knowing what not to do. What happens when you eat a big meal after your water breaks? Find out in our list of the worst things to do during childbirth, right here.